Healthcare reform is going to be a prominent issue in the election. Other than the economy, it's probably going to be the most prominent domestic issue, but there's nothing inevitable about its success. We first started to reform the healthcare system in 1912, and it's a century later. So if there's one thing we should have learned through the history of healthcare reform, it's that there's nothing automatic, there's nothing easy about this. This is going to be very hard to do. At the same time, I would say it has the best chance that it has had since 1993. One of the problems with the healthcare system right now is there is no single entity that is responsible. It's such a fragmented system. It's not really a healthcare system at all. It's a non-system. And controlling costs is very difficult. If we are going to control costs in this country, we're going to have to concentrate responsibility. And that probably means our larger government role, either in setting limits on how much we spend or regulating insurance companies, as well as hospitals and doctors. The candidates do talk a lot about cost control. And in fact, this is an area where Democrats and Republicans agree. They all say they want to increase the amount of money we spend on prevention. They all want electronic medical records. They all want to coordinate care for the chronically ill better than we do right now. And so there's broad consensus on that. The problem is that cost control represents what I like to call faith-based cost control, because there's actually not a lot of evidence that any of those measures would control costs. Each one of them is a good thing to do on balance. None of them is going to stop the tide of healthcare spending in this country. I think where healthcare figures in the broader economic picture is it is part of the squeeze on the middle class. They're experiencing all this sort of economic insecurity around them, and rising gas prices and the housing market collapsing. Meanwhile, there are health insurance premiums, and what they have to pay for deductibles and co-payments and so forth is going up. And we should not forget that this is not just a matter of medical care. Health insurance is also a financial issue. If you look at the growth of healthcare costs right now, and you look at the growth of wages and income among American workers, what you will have a decade or two from now, if we do not act to change this system, is a situation where tens of millions of American workers are going to lose their health insurance, in addition to the about 50 million that already don't have health insurance. So if we don't act right now, and within the next few years, we're going to have an explosion in the healthcare system of uninsured Americans. In order to get the public behind health reform, you have to convince the insured that reform is good for them, that it's not going to hurt them, and better yet, that it might improve their circumstances. If you can't do that, you're not going to be able to pass health reform. Healthcare fever is a disease that I made up, but I think it's actually an epidemic that much of the public has. And it's the belief that healthcare reform is around the corner, that the system is in so much trouble, that things are so bad, and that there's so much momentum behind reform that everything's going to work out, and it has to be that this is going to pass. And the reason I have called that a disease is it's delusional. We've had exactly the problems that we're talking about now in the election: high costs, businesses having trouble affording insurance, millions of uninsured. We've had those problems for decades in the United States. And so the fact that we're experiencing them again is no guarantee that it's going to work out.